morning, good afternoon, and good evening. So nice to see many of you from different countries and different time zones. Before we start our webinar, always thank you for giving us this great opportunity. And Dr. Sweta Singh, our Chief Administrator, will start the session.
This is Dr. Shweta Singh, KHA Chief Administrator, would like to take privilege to introduce our KHA Homeopathy Study Group Pro Bono. It was organized and founded by homeopath and humanitarian Kavita Kugnur, President and CEO of Kavita Holistic Approach, KHA, on May 5th, 2020. This study group is intended to be an offering from Kavita to the homeopaths around the globe. Sharing, goodwill, and solid clinical work within the classical model are foundational principles for the KHA. Kavita is HNA accredited CPT provider and outreach coordinator of CNCP, is a great leader and mentor, international speaker to name few, joined American Homeopathic Conference JANC Mission 5000 LMHI, committed and passionate for homeopathy. She supports the charity organization the Kevin Friendly Foundation, a non-profit organization that helps to serve poor people in greater needs in India. KHA's mission and vision are very unique to inspire young homeopaths, mentor, provide excellency for educational purposes, using holistic approaches via webinars, which are based on principles of classical homeopathy, and provide professional continuing educational homeopathy credits for practitioners. We provide merit certificates for spreading the light of homeopathy around the globe. The study group generally offers free monthly webinars once or twice a month. Spending the last 2 years, more than 100 educational webinars with over 250 recordings, some HNA approved, were hosted by Kavita Holistic Approach. By virtue of Kavita's charisma and commitment to service in the field of homeopathy, she gathers and brings together dynamic, like-minded teachers, honorable guest presenters, and inspires young homeopaths around the globe. The study group celebrated stage 4 cancer survivors by providing moral support, offering them space to share their dramatic and encouraging stories through a KHA series titled Inspirational Book Talks. Each webinar is recorded so members may view the presentation at their own convenience at YouTube channel Kavita Kugnur if they are unable to attend the live session. KHA Homeopathy Study Group offers free recordings to homeopaths. This is an exciting study group rich in substance and soul. Monthly newsletters showcasing upcoming events, previous recordings, and articles reach more than 2,000 homeopaths worldwide. Kavita's pro bono's experience with this study group and her outreach with other organizations has also been a most awesome personal reward. She leads a team of 15 to 25 people in such a way as to foster harmony and group unity. Dr. Kavita is the recipient of Mathalman Community Service Award by National Center for Homeopathy and Best Entrepreneur Award from Dr. N. Lingaraju, Principal of JSPS Homeopathic Medical College, Hyderabad, India. Association, a prestigious organization, honored and awarded her for selfless homeopathic veterinary services at Ladies Night Out on October 2022. Also, Dr. Kavita received the prestigious Legendary Homeopath Award with joint hands of Honorable Health Minister Dr. Ram Singh Bawa, Senior MLA Mr. Harbhajan Singh Chima, Ex-Director Homeopathy, Government of Uttarakhand, and Chairman of HomeoCure and Research Institute during National Homeopathic Seminar, Homeopathy, the Future Medicine at Kashipur on 21st August 2022. Our executives, Dr. Deepak Sharma, Dr. Rajneesh Kumar Sharma, Kachi, Baba, and Michael and myself, Kachi, were also recognized that Dr. Kavita was honored as Women of the Year 2023 from prestigious organization NATA, North American Telugu Association, USA. Dr. Kavita was also honored by renowned KHA Executive Committee on Mother's Day at Michigan, USA with KHA Community Service Award 2023. We are extremely happy and proud that we celebrated 12 years of our book, Beyond the Limits, a challenge to prove oneself. And in January 2022, we launched our ebook, The Dose of Spirituality with Kavita, in presence of honorable guests of speakers, American Institute of Homeopathy President Dr. Alex Becker and Council for Homeopathy CNC President Dr. Sheeta Tiwari at our webinar. At our second annual celebration, our honorable guest of speaker, Dr. Joash Ram, Chairman of of Enlightenment Education launched audiobook and hard copy of her second writer, A Dose of Spirituality in Kavita. We are
A very good evening to all of you. This webinar is moderated by myself, Dr. Yashika Arora Malhotra. It is being recorded as we speak. We will take questions at the end of the webinar, and we'll post the jot form in Zoom webinar chat at the end of the webinar. Please fill the forms to receive certificate. If you're watching live webinar, you can also email us at kastudygroup@gmail.com. I would like to request you all to kindly mute yourself and turn your video off for better connections. And now it's high time that we should start the webinar without wasting any more time. Let me introduce you to the honorable speakers of today. We have with us today Dr. Kusum S. Chand ma'am and Dr. Poonam Chablani ma'am. Dr. Kusum S. Chand ma'am is a medical graduate from the batch of 1964 and postgraduate in medicine from the batch of 1970 of Maulana Azad Medical College, University of Delhi. She is a member of Faculty of Homeopathy, MF Home, London, since 1998. She also has a clinical experience of over 45 years and has been visiting professor as professor and examiner of medicine at Nehru Homeopathic Medical College of Homeopathy, New Delhi, for over 25 years. She has been an active participant in Government of Delhi project on role of homeopathy in MDR TB, resource person for CCRH on national campaign on mother and child healthcare since 2007, and also a reviewer for the journal IJRH, International Journal of Research in Homeopathy. Her work on tuberculosis has won national and international awards and has been published in international journals as well. Currently, she is visiting head of Department of Homeopathy at Max Vaishali Super Speciality Hospital, Ghaziabad since 2008, a member of Advisory Board of International Journal Homeopathy. She's also the author of the book Dare to Differ, A Doctor's Quest for a Gentle Cure. We would like to welcome you, ma'am. Also, now I would like to introduce you to our second speaker, that is Dr. Poonam Chablani, ma'am. She's BHMS from Nehru Homeopathic Medical College and Hospital, Delhi, 1993, and PG NIHFW, Health and Family Welfare Management, PGDMH, Mental Health, NDDY, Naturopathy and Yoga. She's also a Reiki Grandmaster and ex-Dr. Jugal Kishore's clinics. She's a senior homeopathic doctor practicing since last 30 years and has participated in organizing many health events with many organizations, including Homeopathic Cardiologist of India, with Homeopathic HCFI, Rotary Lion Association, etc. She's an executive member of NHMC alumni, life member of SDHA, IAHP, Hamari Ka Volunteer, and also Kavita Holistic Approach. She has got many awards, to name a few: National Excellence Awards, Jugal Kishore Award, Dr. Hahnemann Award, Appreciation Award by Board of Homeopathic System of Medicine, Delhi. She's also won the award by Health Minister Mr. Shripad Nayak ji on World Homeopathic Day on 9th and 10th April 2016 at an international convention of Liga, LMHI Vigyan Bhavan. She's also the awardee of Chikitsa Seva Ratan Puraskar 2019 by Delhi government. She has her articles in leading newspapers like Hindustan Times and Mail Today. Yoga has brought respite in asthmatic patients, insomnia, pollution, and asthma. The topics. She's looking forward to great learning from both these speakers. We should like to proceed with our session. and they will be speaking on the known case of extrapulmonary tuberculosis with multiple abscesses. I would like to request our speakers to please take the session from now. Over to you, ma'am.
Thank you, Yashika. Is my audio okay? Is my video okay?
Yes, absolutely.
Thank you, Yashika. Hello, everyone. First of all, I would like to thank organizers for inviting and giving opportunity at this KHA platform. I would like to thank Dr. Kusum Chand ma'am for always being there and for today also. She is my guide, my mentor, my medicine professor, and has helped me for this case. I welcome all of you for today's presentation. To start with the presentation, we will start with the disclaimer. I will share the screen. Is it visible?
Yes, ma'am.
Is it visible? Shall I start?
Yes, ma'am, please.
Thank you. To start with the disclaimer, all the KHA Homeopathy Study Group webinars are for educational purposes only and not intended to diagnose or treat a disease. Listeners can benefit with the information shared at the webinars, and the opinions expressed by speakers, moderators, and attendees are part of educational experience and do not necessarily represent the position of Kavita Holistic Approach, KHA or KHA Pro Bono. To start with today's webinar, the topic is it's a known case of extrapulmonary MDR TB with multiple abscesses presented to you by Dr. Kusum Chand ma'am. She is MD Medicine, MF Homeopathy, and myself, Dr. Poonam Chablani. It's a known case of extrapulmonary MDR TB. That means it is already diagnosed with, and it is with multiple abscesses. Today's agenda is tuberculosis, extrapulmonary tuberculosis, case study, treatment of tuberculosis with homeopathic regime, conclusion, and references. Introduction. Tuberculosis, TB, has been known since antiquity, since ages. In spite of effective antibiotic treatment regimes, it is still a major worldwide public health problem with new cases and many deaths reported every year. Pathogenesis of TB. It is an infectious disease. It is caused by Mycobacterium tuberculosis complex. It is an intracellular pathogen. It can live dormant in macrophage for many, many years. And there are two types of TB that usually it affects lungs. 80% it is pulmonary TB. And in 20%, it affects the organs other than lungs. It is called extrapulmonary TB. Now we will study the transmission from exposure to infection. The transmission takes place through cough and sputum. Of sputum smear of positive pulmonary TB patients only. I've highlighted of positive pulmonary TB patients only as droplets from cough, sneezing, and talking. So it is a droplet infection. Extrapulmonary TB do not transmit disease. It is important. Exogenous factors are considered, for example, quantity and virulence of bacteria in a bolus, degree of contact with the patient, and hygienic measures like overcrowding and poor ventilation are important in contacting infection. Once infected, one can develop disease at any time, but may never get disease. So it lies dormant and it is called latent TB. Now, how it develops from infection to disease. The development of disease after acquiring infection depends largely on endogenous factors of the person, such as innate susceptibility to the disease, number one, and number two is level of function of cell-mediated immunity. In other words, the constitution of the patient, physical and emotional stresses may trigger the development of disease. 90% of the people do not develop tuberculosis disease. We should understand the difference between latent and active TB. Usually, there is a skin test and a blood test to diagnose TB, but it cannot differentiate between latent and active TB. So, other tests are done that include chest X-ray. In latent TB, chest X-ray is normal, and in active TB, chest X-ray is abnormal. Sputum is negative in latent TB and it is positive in active TB. Then bacteria in the body is there in latent TB, but it is in the inactive form. And in active TB, bacteria is present in the active form. Spread. A latent TB person cannot spread TB to others, whereas in active TB, it can spread TB to others. Both needs treatment. In latent TB, the treatment is needed to prevent TB disease in future. And however, if exposed to MDR or XDR, that is multi-drug resistance and extreme drug resistant, these preventive measures are not an option. In active TB, active treatment is necessary for the treatment. Next is the homeopathy and TB. Since we are on the homeopathic platform, we will talk about homeopathy. Homeopathy was widely used in the treatment of TB during 19th century. In 1827, Dr. Baron Boninghausen was treated for purulent TB. Dr. Burnett also reported 54 cases of various types of TB, including 21 cases of TB lymphadenitis successfully treated with the nosodes, tuberculinum and bacillinum. Dr. Kent also reported cure of TB lymph node with tuberculinum. The discovery of streptomycin and other antibiotics led to the decline in the use of general measures and homeopathy for TB. Immune modulation and homeopathy. Immune system is subjected to a complex method of cellular and molecular interaction. All of you know about autophagy. Autophagy means auto means self and phagy means eat. So it means self-eating. Autophagy is the body's way of cleaning out damaged cells in order to regenerate newer, healthier cells. It is like recycling and cleaning. It is like a reset button and it promotes the survival and adapts to various stressors and toxins in cells. Autophagy is recently recognized as the innate and adaptive immunity defense against intracellular pathogens. Induction of autophagy by physiological, pharmacological, and immunological means can eliminate intracellular Mycobacterium TB. It seems that qualitative aspect rather than quantitative aspect can be important. It has been reported that the ultra-diluted antigens can transfer signals to the immune system. They transmit the signal and modulate its response when the organism is in challenge with related organism. The autoreactivity of T cells, like we know the T helper cells, is managed by immune system. Depending upon the concentration of the antigen they encounter, if they see high concentration of the self antigen, they are killed. But when exposed to the low doses, they undergo special kind of active inhibition called bystander suppression. It can be postulated that the immunity with the homeopathic intervention, specific and non-specific immunological endogenous factors can be addressed in individual patient. Now, TB in India. In India, TB is an endemic with a population incidence in all types about 1.5%. TB lymph node is most common clinical type of EPTB, that is extrapulmonary TB. The Indian National TB Control Program was started in 1962 when we were not there and revised in 1993 and named as RNCTP, that is a revised National Control TB Program. The recommended ATT, that is anti-tubercular treatment, consists of first generation of antibiotics, that is isoniazid, zinamide, and streptomycin. Different regimes are called category 1, 2, and 3. You are all familiar with the DOTS treatment, that means directly observed treatment. It is a short course therapy where ATT is administered in the front of physician or health worker for better compliance. These measures are not able to prevent the emergence of MDR and XDR strains of Mycobacterium TB. So we have covered tuberculosis today, and coming to the other part of the session today is extrapulmonary TB. As you all can see the diagram, now we have talked about extrapulmonary TB. It occurs in only 20% of the cases of TB. Rest 80% is pulmonary TB. In 20% of the cases, it affects the organs. All these organs other than the lungs are affected, and it is difficult to diagnose. So we will understand why it is difficult to diagnose. Since EPTB is less common, it is not common, it is less common disease. So doctors first think of other causes of the symptoms. It often sits on the sites that are difficult to assess. With EPTB, a small amount of TB bacteria, small amount, can often cause a great damage. HIV infected in children are more at risk. Children are at least twice as likely to be reported with EPTB than adults. It is easy to miss. Symptoms are unspecific, and clinicians may not consider in their differential diagnosis. If untreated, the disease may be fatal in 50 to 65% of the cases. Like you can see the diagram of extrapulmonary TB, and on the other side you can see the common sites. It is from most common to less common. The most common site is lymph node. In the diagram you can see neck lymph node, scrofula. It is also known as tubercular lymphadenitis, and usually a cervical, submandibular, supraclavicular lymph nodes are involved. On examination, the lymph nodes are painless, firm, fixed, matted, and overlying skin can be red. And it can complicate to ulcer, fistula, abscess, and caseous necrosis can be there. If hepatic lymph node is involved, it will lead to jaundice, portal hypertension, and portal vein thrombosis. If renal lymph node is involved, renal artery compression leading to renal hypertension. If mesenteric lymph node is involved, it will lead to intestinal obstruction. Diagnosis of lymph node is by lymph node TB is by FNAC and biopsy can be done. DD can be lymphoma and metastasis. Treatment, standard ATT treatment, and surgery rarely required. Second most common site is pleura. Pleura causes pleural TB, and the signs and symptoms will be of typical TB, like fever, cough, and weight loss. In addition, the patient can have chest pain, shortness of breath. There can be effusion, pleural effusion, and on examination, dull breath sounds are there. Thoracocentesis can be done. On thoracocentesis, the fluid will show, you can see the fluid can show ADA, oblique lysozyme enzyme positive. This is a very important and unique feature and helps in diagnosis of Mycobacterium TB. Other tests can be done are AFB, microscopy, and culture can be done to diagnose it. Third most common is a generative urinary TB. You can see in the diagram, it affects the renal system also, renal TB, and it affects the genital systems also, causing fallopian tube infection and other problems also. So, in 10 to 15% of cases, genitourinary tract TB is seen, wherein symptoms will be dysuria, frequency, nocturia, hematuria, higher flank abdominal pain can be there. It is diagnosed late only after severe kidney damage occurs. There can be hydronephrosis, strictures. Investigations, you can do urine analysis, 90% something abnormal will be there. Pyuria can be there. Hematuria without bacteria. It is very important. Hematuria with bacteria is infection, and hematuria without bacteria is suspicion of TB. It is very important. Other tests can be done, IVP, CT scan, MRI, deformity in the tract can be seen by this. Urine culture, 3 morning samples can be done, and 90% you will get something. In males, it leads to, you can see epididymitis, orchitis, and prostatitis. In females, you can see fallopian tube infection, infertility, endometriosis, pelvic pain, and menstrual irregularities. Next comes, and the fourth common thing is bones and joints are affected, causing bones and joint TB, or you can see in the diagram, it is known by Pott's disease, TB spine. You can have tenderness in the spine, and the X-ray and CT classical image is seen as vertebral column collapse. Next, fifth point is meninges. If it affects meninges, you can see it is in the diagram TB meningitis. The signs and symptoms are headache, mental confusion, stiff neck rigidity, coma. And tuberculoma is a rare thing. And it's all this show TB meningitis and tuberculosis shows CNS spread, central nervous system spread of TB. Investigation in this thing is cerebrospinal fluid, lab findings, and CSF smear for AFB. CT and MRI can be done for hydrocephalus. Next, on the 6th is the peritoneum. Peritoneum TB is the commonest site. The terminal ileum, cecum, right lower quadrant. Signs and symptoms of abdominal pain. The differential diagnosis of the abdominal pain can be done with appendicitis because it is the same area, right upper lower quadrant for appendicitis as well as the TB. There can be swelling, obstruction, blood in the feces. It is called hematochezia. Palpable mass can be seen, and typical TB symptoms, fever, night sweats, and weight loss. If the peritoneum, if the lymph node ruptures over there, then it causes peritonitis. And signs and symptoms of diffuse pain can be there. Ascites and paracentesis can be done. 7th is, most common site is pericardium. Pericardium, in the effusion can be seen. 8th commonest site, other forms can be there also. Whole body is affected by TB. Other forms can be, it can affect eye in the form of chorioretinitis, uveitis, panophthalmitis. The ear may show tympanic membrane perforation, hearing loss. Cutaneous TB can be there, like in the diagram you can see the skin TB. We'll be discussing this. And mastitis inflammation of the breast tissue, adrenal insufficiency. In the diagram, you can see the adrenal TB. Addison's disease is the commonest cause worldwide. And then it can be congenital TB through transplacental route. So we have covered the second part, extrapulmonary TB. Now the third part, case study. Today's case is known case of extrapulmonary TB, MDR with multiple abscesses on ankle, back and thigh. A 52-year-old female patient came in my clinic on 28th October 2022 with the abscess in the right ankle covered with the white gauze. Onset since May 2022, swelling in the right ankle, lateral aspect, that is outer side. It was increasing, swelling was increasing, it was having pain, it was discharging wound despite treatment from many specialists. The patient was admitted for high-grade fever. Multiple investigations were done. Ultrasound guided aspiration was also done and diagnosed at Max Saket as tubercular arthritis right ankle, tubercular lymphadenopathy, and anemia normocytic normochromic. This is diagnosed at Max Saket. In MRI ankle, we saw calcaneal osteomyelitis. So sinus is formed, osteomyelitis is there, it was continuously discharging. Lymph node biopsy was done on 15th of June 2022, showed necrotizing granuloma, that is typical sign of TB. Patient was on ATT since 18th June 2022 and the treatment was done from Dr. P.D. Rath. The medicines she was taking were Cinex 600 mg OD, Combitol 1200 mg OD, Pyazine 1500 mg OD, Levoflox 750 mg OD, Benidorm 40 mg half tablet OD. Orthopedic doctor's consultation was done on 8th of July. So it was, this was done in June and patient was not okay. So she consulted orthopedic doctor consultation in July. Patient was on ATT and was not improving symptomatically. The right ankle abscess, there was a continuous pus discharge. Multiple discharging points were seen. Skin appeared necrosed and dead. Plan, as per the doctor planned the thing, was exploration and evaluation, debridement, and vacuum-assisted dressing, that is a vac dressing, vacuum-assisted closure of the dressing, vac dressing, pus for culture and sensitivity, TB PCR, if positive, do immune assay for antibiotic resistance, gram staining, Zeal-Nielsen staining for AFP, and histopathology of tissue was suggested. And patient and her attendant was counseled regarding the need of multiple debridement. There can be multiple phases of debridement. Multiple vac dressings will be required. Delayed wound healing. It will not be easy process. We don't know the time, how much delay it will take. Progression of the infected area and future multiple surgeries can be there. And for the treatment, she was told to continue ATT and the dressings. Patient became hopeless because of unending treatment. There was no ending time, how much time it would take. So she opted for alternate treatment. Homeopathic consultation. The patient came to me on this thing. The first visit of the patient was on 23rd October 2022. Since they were knowing me previously also, they called me up and came to my clinic. On the first visit, there was an abscess right ankle that was persisting from May 2022. When they came, it was dressed with a white gauze. When I opened the gauze, it was raw, discharging wound, pain, redness, slog. It was not healing. Secondly, there was a lump in the left thigh. Ankle was right side. It was an abscess. And the other thing, second was lump in the left thigh and right paraspinal lump. Three areas were covered. In addition, the patient complained of stiffness of the neck and shoulders, limitation of the movements of both arms. So I prescribed Rustox 1M, Arnica 1M Sunday, followed by Calendula 30 and Silicia 6X for 1 week. Patient was better, so I repeated for few weeks same way and advised to continue ATT. Second visit was on December 2022. First visit was in the last week of October. So after 1 month, it was nearly last week of November. Patient came to me in December. Abscess of the right ankle was better. The discharging and everything was better, reduced. The left lump in the right paraspinal was same. Lump in the left thigh moved upwards from knee to groin. Earlier in the first visit, it was towards the knee joint. And in the second visit, it shifted from the knee towards up to the groin. And inguinal lymphadenopathy was also there. Lymph nodes were hard and palpable. Stiffness, neck and arms was better. Treatment continued, and I added Calcira iode 3x, Calendula 30, and Silicia 6x. Third visit, January 2023. Right ankle abscess was better. Occasional discharge. Now it was not discharging all the time. Lump in the left thigh still increasing. Lump in the right paraspinal same. Left-sided complaints were there. Acidity and suffocation of the throat. So I gave Lachesis 1M, 1 dose, Gunpowder 30, Echinacea 1X, and Hecla lava 30. All in the low potency to absorb that discharge also. Advised patient again to continue ATT and follow concerned doctor, but patient refused as she was feeling better with homeopathic treatment and wanted to stop ATT by herself. But she was counseled not to do so. You cannot stop ATT halfway or by yourself. So it is better to talk to a doctor or continue till you follow the doctor, take the advice from the doctor. In fourth visit on February 2023, we consulted Dr. Kusum Chan, ma'am, and she is MD Medicine and MF Homeopathy. She has both the specializations. Over to you, ma'am, for further guidance.
Thank you, Dr. Poonam, and hello, everyone. Hello to all, and thank you to the organizers. Before I discuss the prescription, I will explain my method of treatment, tuberculosis with homeopathic regime. So we'll discuss homeopathic regime, which I have developed. Next slide, Poonam.
Yes, ma'am.
So homeopathy was widely used in 19th century. Its use declined with the discovery of antibiotics in mid-20th century, and they appeared as a boon to advancement of medical science. But overuse and misuse of antibiotics led to increased drug resistance, and they have become the bane of early 21st century. Next. Results from World Health Organization survey carried out across 22 high and low income countries between March 2016 and July 2017 revealed antibiotic resistance to a number of serious bacterial infections. WHO spokesman Christian Lord-Mayor said the survey's findings raised many red flags among health professionals, admitting that it was one of the biggest threats to global public health. It leads to higher medical cost, prolonged hospital stay, and increased mortality. Next, Poonam. The World Health Organization needs to change the way it prescribes and uses antibiotics. A total reliance on only antibiotics has been an easy and one-sided approach. A change in behavior and recognizing the role of the self-defense mechanism of the living beings are important in combating antibiotic resistance. Without such change, it will remain a major threat, even if new antibiotics are developed. An integrated approach to the treatment of chronic disease may be the answer to this menace. It may be between homeopathy as a regime and antibiotics. Next, patients with chronic disease and those with recurrent complaints are usually multimorbid and on multiple drugs. They have complex symptomatology. Mainstream medicine has no promising or permanent treatment. Repertorization of such cases showed some remedies were covering the presenting complaints, while others were covering the causative factors, and yet others were needed for an anti-miasmatic approach. Next slide. In order to achieve the best possible reaction in a limited span of time, these remedies were studied in relationship to each other while working on TB project. A regime of medicines was formulated. This comprised generally of a morning medicine, one before lunch and dinner, and a weekly dose of anti-miasmatic medicine. Next slide. It has been found that remedies used in a certain systematized manner simultaneously target multiple factors in the teleonomy of the patient, which is required for comprehensive treatment. This fulfills the holistic ideology of homeopathy, which is very important. When used at the same point in time, they promote an all-round improvement in the case. It is as if lifting the system in one go and picking up all the loose ends so that the use of other conventional drugs for symptomatic relief is minimized. Next. A project to explore the possibility of using homeopathy in the treatment of tuberculosis was an undertaking by Government of Delhi, India. It was conducted in 2 phases. In phase 1, 142 category 2 failure cases were treated with add-on homeopathy. 94 cases had a follow-up of 1 year, and it was found that homeopathy was useful and complementary to anti-tubercular antibiotics. This is also very important because otherwise the general impression is that homeopathy and antibiotics cannot be used together. Next slide. In phase 2, randomized, double-blind, placebo-controlled clinical trial was conducted on 120 multi-drug resistant pulmonary TB patients, confirmed by drug sensitivity test from 2003 to 2007. Actually, we had seen 220 patients, but first 100 were not analyzed because of some bias in the blinding system. So in this study, statistically significant improvement was seen with add-on homeopathy in chest X-ray, weight gain, increase in hemoglobin, and reduction in ECR. In subgroup analysis of 81 culture-positive patients, where homeopathy was started at the same time as antibiotics, cure rate was 11.4% more in homeopathic group of 44 patients as compared to placebo groups of 37 patients. This is also a very important point because if you start homeopathy and allopathy together, antibiotics together, you get much better results. Next slide. In a parallel study on 50 cases of tubercular lymphadenopathy, treated with only homeopathy. This is again, we treated only these patients with only homeopathy because it was not because extrapulmonary tuberculosis is infectious, but it is not contagious. It cannot spread. So one could treat the ethical part is not involved in it, and we could treat these patients only with homeopathy. A homeopathic regime was formulated for the treatment of tuberculosis. It comprises of a patient-specific constitutional remedy which targets individual response, disease-specific nosode or biotherapy, which helps in providing immunity against the bacilli, and a supportive medicine, Silicea 6D decimal potency, as a general stimulant of leukocytic and fibroblastic activity. So this project was a great learning. Firstly, it became very clear that homeopathy is complementary to antibiotics. They can be used together. Then also tuberculinum can be used in active disease of tuberculosis, which earlier in the books is written that in active tuberculosis you cannot use tuberculinum. Particularly Kent has mentioned that it can be used only in cases of congenital patients with history of tuberculosis or family history or past history, family history of tuberculosis. Also, Silicea, see, this was interesting reading that Silicea in low potency acts as a supportive medicine, and it acts as a general stimulant of leukocytic and fibroblastic activity, where it helps in expelling the pus-producing microbes, including those of TB. So repertorization chart. So this is how we repertorize. We took from generals, we took abscesses, then chronic abscesses, then we took tuberculosis of tuberculosis of the skin, and then we took this particular patient, though she was suffering so much, but yet, you know, she kept on saying, when she came to me, she kept on saying, no, I'll get better, and Dr. Poonam is doing a very good job, and I've become better, and I will get better. Maybe she was wanting to she was not wanting to take ATT, and that is why she was saying it, but that was the most prominent mental symptom that I got from her on the first visit. And so I took this rubric, painlessness of the disease, usually painful. And then I took, from skin, we took ulcers, discharging yellow, having a yellow discharge, because her discharge from the ankle abscess was yellow in color. Then I have seen, after seeing over 400 cases of tuberculosis, I have seen that most of these people suffer from liver and stomach problems, mainly because of prolonged use of antibiotics, and their immunity also gets low. So that is why, and this patient, because she had refused all the investigations, still we took this abdominal complaints and stomach inflammation. And in mind, we took well when she says well when she is not, when she is sick. So these were the rubrics taken, and lycopodium and sulfur had 17 points each. Even Merck had 17 points each, but we chose sulfur. And we took arsenic because arsenic was also coming for abdominal and stomach complaints, as well as tuberculosis and yellow discharge from the abscess. So the prescription was sulfur 30. Usually the constitutional medicine we give in medium potencies, and I take 30 as a medium potency. So we gave the constitutional medicine as 30C, and the arsenic was used because of the discharge local for the local condition, and this was used as Poonam. Was it 6 or 30?
6.
Hello.
Arsenic 6.
Arsenic in a low potency because this discharge was coming, and silicia also we gave silicia 6x. Then we used tuberculinum 200 once a week. So my regime generally is that constitutional medicine is most important, which has to be given in medium potency. The nosode should be given in frequent doses, generally a weekly dose. Burnett had given a weekly dose. So I also tried a weekly dose and it worked. So weekly dose in a higher potency, and the local medicine for local condition should be in the lower potency because it has to be given more often. And so the prescription was sulfur 30, one dose in the morning, arsenic 1 dose in the afternoon, and silicia 6x 1 dose in the evening, from 6 days a week. And 7th day was tuberculinum 200. It was Poonam one dose or 3 doses?
1 dose.
1 dose. And see, another thing about this about the regime is that as long as the patient is improving, one does not change the potency. And the same potency should continue till the patient patient stops reacting to that. So at that point, either the medicine has to be changed or the potency is changed. So over to Poonam for further prescriptions.
Thank you, ma'am. Thank you so much. And you are bridging the gap, expanding the horizons. A lovely slide, ma'am.
Thank you.
We will continue now the case study as per homeopathic regime with ma'am. So ma'am will also talk in between and I will also talk for the case. 4th visit was on February 2023. We consulted Dr. Kusum Chand ma'am. She is MD Medicine, MF Homeopathy. She has got both the specializations. The patient was having right ankle abscess and it was better with my medicines. The other thing was lump in the left thigh that was increasing. With the ma'am, we decided to take the measurements. The left thigh lump increased to 9.5 inches and width was 10 inches. Right lump in the right paraspinal area, the length was diagonally 2.5 inches and width was 2 inches. Patient complained of burning sensation off and on. So with ma'am, we gave the homeopathic regime, as ma'am told right now, tuberculinum 201 dose on Sunday, followed by sulfur 30 and arsenic 6 and silicia 6x as a supportive treatment, all 1 dose daily for 2 weeks. Anything, ma'am?
It's fine. Continue.
5th visit was On 12th February 2023, right ankle abscess discharged better. Left lump in the left thigh, small pus point appeared. Pain better, burning better. Lump in the right paraspinal also started reducing. Treatment repeated for 2 weeks, same way.
So, since the
Yes, ma'am.
the ankle discharge was reducing and the paraspinal lump was reducing, but the thigh lump was increasing in size and a pus point. So she appeared very sick, and it was very and yet, because she was generally better, we decided to continue with the same treatment regime, in spite of the fact that the lump in the thigh had become very big and it was looking very menacing. Yes,
Yeah.
Poonam?
Yeah. Then there was 6th visit on 28th February 2023. Lump in the left thigh was increasing. Earlier, the length was 9.5. Now it became 10 inches. Width, earlier it was 10 inches and now it became 11 inch. 1 inch more. And discharge was thin and yellow. Right ankle abscess is better. Lump in the right paraspinal area is also better. Medicine repeated for 2 weeks more. When we started the homeopathic regime, we are giving 2 weeks medicine to observe that thing. Anything, ma'am?
Yes, no, continue. So we are continuing the same potency and same medicine in spite of small changes, but overall the patient was getting better. So we continued with the same regime.
Yeah.
Yes.
7th visit was in March 2023. Shall I continue?
Yes, continue. Please continue.
7th visit was on March 2023. Left thigh wound drained out. Earlier it was a small pus point, now it drained out and the swelling was gone. There was thin yellow discharge occasionally. Earlier it was continuous discharging, now it is occasional discharge. In the right ankle, abscess got better. Lump in the right paraspinal also got better. The measurements were done again for the right thigh and the left thigh. Right thigh is 19 inches, left thigh is 21 inches. So 2-inch difference is still there. Patient complained of pain in the legs and back and she cannot sleep. We gave tuberculinum 200, 1 dose on Sunday, followed by belladonna 30 and Rustox 30. Rustox 30 is covering the pain in the legs and back, and when the swelling is gone and everything is there, the patient still slight redness was there, so we gave belladonna 30 also. Anything, ma'am? Anything else?
Yes. So what happens is we don't have to stick only to the regime. If a new symptoms develops, so my experience says that should also be treated, because we should not leave it that old symptom is coming and that is why we should allow it, because the body is not able to, the immune system is not able to handle the new things, and we should help the body recover from the new symptoms. That is why the new symptoms or any extra symptoms should also be treated with indicated medicine.
Yeah. So we have patient specific, disease specific, and supportive treatment going on all the time. 8th visit was on April 2023. Right ankle watery discharge started again. It was dried up, now it has started again. Right leg pain from thigh downwards. It was in the right leg. The wound was in the left. The left thigh wound became better after draining everything. Lump in the right paraspinal also got better. And the treatment continued. Tuberculinum 200, 1 dose, followed by sulfur 30 and pulsatilla 30. So, first point, the wound drained out, and the other wound that had dried up started to discharge again. Anything else in ma'am here? Tuberculosis 200, sulfur 30, and pulse 30. Here, pulse 30 was given. Patient was crying. Everything was getting better and better, but still the patient could not talk without crying. So we decided pulsatilla together.
Yes.
Anything else, ma'am, to be added?
No. Continue.
Yeah. Ninth visit was on May 2023. Right ankle abscess and left thigh abscess, both are better. Discharge intermittent every few days. Paraspinal abscess is also better. Patient had weight gain. So the signs of improvement are there. All the discharges, all the abscesses are better. Weight gain started, so improvement is there. Appetite better. Patient still complained of pain in the hip, knee, and back. So, ma'am advised Uprise D3, vitamin B12, because in the blood reports, vitamin D and B12 was less, so we prescribed this thing also. And SOS pain paracetamol was also prescribed by ma'am, as she is MD medicine also. Ma'am also advised culture and sensitivity, but patient refused and stopped ATT as the family felt patient was better only with homeopathy. So medicine was given the same way. Tuberculinum 200 one dose Sunday, followed by Calcarea Phos 30. Calcarea Phos covers the follows tuberculinum in a better way and gives a good result.
It is good for osteomyelitis,
Yeah.
tuberculosis of the bone.
Hmm.
Calcarea Phos is good, and that is why
And it will additionally, with Uprise D3 and vitamin B12, it will additionally reduce the pains, calcium. We are giving homeopathic calcium also. CPR 30 was given because she was having hot flushes and there was no menses for 1 year. Rustox 30 for the pains and supportive adjuvant was given, Silicia 6x. Anything else, ma'am?
No, continue, please continue.
10th visit on June 2023, right ankle abscess and left thigh abscess better. Paraspinal abscess not visible, totally gone. Vertigo was there. Weight gain, patient was weighing 69.5 kg and previously she was weighing 55 kg, nearly 14.5 kgs, 15 kgs weight gain was seen. So the treatment we gave the same way, tuberculinum 200 one dose, followed by Calcarea Phos 30. Conium 30 was given for vertigo and adjuvant supportive treatment for Silicia 6x.
So here the Calcarea Phos was given instead of sulfur as a constitutional medicine also. So we removed the sulfur and we followed it up with Calcarea Phos because of the osteomyelitis of the bone.
So,
and also because, pardon?
Yes, ma'am.
I just wanted to say that the Calcarea Phos is also acting like a constitutional medicine for her.
Yeah. Tuberculinum 200 is a disease specific according to the regime. Calcarea Phos is a constitutional medicine, so patient specific. And conium is symptomatic because patient was saying vertigo. So symptomatic treatment, and Silicia was on the third, supportive treatment. So regime, all the three is coming. On 11th visit was on August 2023. Right ankle abscess. There was a small drop discharge. And left thigh abscess totally dried up. Paraspinal lump not visible. Weight gain 4 kgs more. So earlier was 14.5, nearly 15, and 4 kgs, totally 19 kgs weight gain was there. So patient was advised to reduce weight and walk. In medicines, we prescribe tuberculinum 200 one dose, followed by Calcarea sulf 30, as all the discharges were chronic discharges. We have given everything, and now Calcarea sulf we tried here. And CPR 30 for hot flushes and no MC for 1 year. Cilicia 6X as supportive. On 12th visit was on September 2023. There was no discharge since 1 month in any of the abscesses. All the abscesses, both the two abscesses are dried up and the third lump was not visible. So patient was advised to stop further medicine and reduce weight. Now the patient's weight was 75 kg. It started from 55 to 75. So 20 kgs weight gain. It is a good sign that the patient is gaining weight, but still patient has to reduce weight. Anything else, ma'am?
No, that's fine.
Like you can see the photographs, this is the right angle. Is the photo okay? Can you see it? You can start the first, you see the first slide. It started with the swelling in the right ankle on the outer aspect. In the second, you can see the swelling is growing and it is forming a bluish hue. In the third, there is a pus point can be seen. In the fourth, you can see the white gauge. Patient came at this stage to me. When I opened the gauge, it was discharging. In the fifth slide, with the medicine, my medicine, the discharge reduced and stopped. The wound abscess is drying, but still the thigh lump was increasing. So we reviewed with ma'am and with her guidance and with homeopathic regime. After a few months more treatment, this is the sixth slide. Totally dried up abscess, no discharge. Anything to be added, ma'am, here?
No.
Next, you can see the left thigh. When it started as a lump in the left thigh, you can see the swelling towards knee. You can see the blue veins. The patient was not able to bend the knee because of the swelling in the first slide. In the second slide, you can appreciate the swelling has moved up, lump has moved upwards from knee to groin. Now she can move the knee, but thigh movement has been restricted. And it is increasing, and there is small elevated area that you can see. It became into a pus point and it discharged, and leaving the third slide, you can see the abscess. It continued to discharge for a few months, and with the homeopathic regimen that ma'am advised, in the fourth slide, you can see the wound has totally discharged and the thighs are of equal size and everything was normal. She is able to move properly now. Anything, ma'am?
No.
Third abscess was paraspinal abscess. It was when we visited ma'am, we did the markings. It was nearly 2.5 and 2 inches in length and width. And after it reverts with the treatment, it disappeared. So there is no comparison of the photo. Anything, ma'am, we have to add? Or I should conclude?
Yes, conclude.
Conclusion. TB is curable. It is infectious but not contagious. It is contagious is only the sputum. Positive coughing patient can spread disease. Positive pulmonary TB coughing patient can spread disease. EPTB, extrapulmonary TB, cannot spread disease. 90% of the patients who contact infection do not get disease. Immunity of the patient plays important role in progression from infection to disease. From regular homeopathic medicine, ulcer was better, but disease was still spreading. With the regime, when homeopathic medicine used in regime form, it expedites cure of disease. These are the references that I have taken, my slides and everything. Thank you so much for your patient listening. I'm sharing my mail, drpoonamchablani@gmail.com, and I'm sharing 2 links. First link is ma'am's book. Dr. Kusum Chand ma'am has written a book, Dare to Differ, A Doctor's Quest for the Gentle Cure, and it is available on Amazon. Second link is my previous presentation that I have done on the KHA platform long back. It is Learn Difficult Cases Treated with Homeopathy and Reiki with Dr. Poonam Chablani. You can see my link and give your views. Thank you so much for patient listening.
Just a minute, I will like to add a
Yes, ma'am.
word for my book, Dare to Differ. In this book, I have written a big chapter for on tuberculosis, and I have added all the 25 cases of tubercular lymphadenitis, where I've given the chart, repertorization chart, and the history, and it clearly shows what made us choose the regime, or what made us form the regime which worked. And anybody who is interested in treating tuberculosis, it's good to read this chapter on tuberculosis from this book. Thank you.
Thank you so much, ma'am, for being there and for guiding me for this case. It was really a miracle. I have not seen like this thing earlier. I'm very happy to be with you as a student again. And over to you, Yashika. I'm stopping my share.
Yes, ma'am. Thank you so much. Thank you, Dr. Kusum ma'am and Dr. Poonam ma'am, for such a wonderful presentation and explaining about tuberculosis. Plus, the case studies was superb. Thank you so much for discussing. I hope our audience had a great learning. So now I would like to share felicitate as an honor, we would like to take the privilege to honor our speakers with the KHA appreciation certificate. Please accept it from KHA Homeopathy Study Group. I'll just share my screen. To Dr. Poonam Chablani ma'am for such a wonderful presentation.
Thank you so much, Yashika.
And to Dr. Kusum Chand ma'am, MD Medicine MF Home, for being our honorable speaker and explaining such a wonderful case on extrapulmonary MDR TB. Thank you so much, ma'am.
Thank you.
Thank you for your gracious presence and for your precious time in sharing your knowledge and wisdom. Let me let me take this opportunity to announce the upcoming January webinar, that is on 21st of January 2024 at 8:30 p.m. IST, 10 a.m. EST, US and Canada. We'll have Dr. Ajit Kulkarni, who will enlighten us on the topic Trapped in Life, that is a case presentation. And Dr. Sheetal Tiwari ma'am will enlighten us on the importance of getting CHC certified. You can find the link to register at our website kavitakhomeopathy.com. Please don't miss the webinar. A heartful thanks to all our viewers and followers to join us today. We have many such informative webinars lined up in the upcoming sessions with many renowned homeopaths. For the upcoming webinar and info or any other updates, you can follow us on our social media handles. Or if you missed any of the webinar, you can watch it at our YouTube channel, Kavita Kukunut. I'm thankful to KHA volunteers for the continuous support and selfless services with which we are able to organize these webinars in successful manner. For any other info, you can reach us at khastudygroup@gmail.com. For the participation certificate, you can see the chat box. I'll be posting the link for the certificate. And now I would like to ask from the audience, if there are any queries, you can share us. We have already some questions. For certificate, you can click on the link. This link is given in the chat box. Ma'am, we have questions. One question is from Dr. Saranjeet Kaur. She wants to clear on one point. As per JT Kent, do not give silesia in case of deposit of tubercle in the lung. as it may suppurate and pneumonia occurs, or the patient may die. So can we give Silesia in TB of other parts of the body, if not in lungs?
Yes, we can. See, Silesia acts both ways, as a constitutional medicine and as well as a general stimulant. So if you give in lower potency, in decimal up to 6x or 6 potency, it works. It will not open the. It will open the.
It will open the wound and TB will go out, ma'am. It is a foreign body and it will go out.
See, it will expel the microbes, and you are giving you are not giving only Silesia. You are giving a constitutional medicine. See, so it is very, very important that you must give constitutional medicine. You can't rely only on Silesia because it's easy to give, or you just give a nosode, tuberculinum. No. See, it is a constitutional medicine supported by Silesia in lower potency, on lower potency only. No, it don't have to increase the potency of Silesia. And because if you read Otto Lesser, the homeopathic materia medica of minerals, see, there he has very clearly written that Silesia in lower potency acts as a general stimulant of leukocytic activity and fibroblastic activity. Means it will form the scar. It will not form it will not break the scar. But if you give it in a higher potency, it might break the scar. So we do, and Kent believed in higher potencies. So that's why he has said. Is it clear to you?
Any other questions? I hope this query was cleared by ma'am so beautifully. Thank you so much from her. Dr. Saranjeet Kaur is saying thank you, ma'am. Any other questions we have? Dr. Ashok sir is raising his hand. I am requesting him to unmute himself. Over to you, sir, if you want to say something.
Yes, good evening, Dr. Yashika. Hello?
Sir,
Hello,
you are
Doctor?
audible. You are audible.
Okay. You see, I'm appreciate for the system of the medicines given, and the patient was better certainly. But still the question, as our lady doctor made it, the sensitivity, what I'm feeling for myself, that Silesia plus tuberculosis every week to give it, where we are, how to deal with that, to have a continuous, never mind for Celsius, very lower potency 6 that we can give it along with that, in whatever the reason. But tuberculosis to give every week for longer time, that gives me, or I should ask a question to Dr. Please try to understand what I mean.
Thank you. Thank you for raising this query. Well, this was the experiment that and that was the result of my seeing over 400 cases of tuberculosis. When I was doing RCT and we were doing the first phase in where we saw 142 cases of tuberculosis, we did not give tuberculinum, but we gave tuberculinum only in cases of tubercular lymphadenitis, and we found, see, it's worthwhile reading Dare to Differ and understand when you see all the 25 cases, case histories, you will realize
Yeah.
why have I chosen. And subsequently, doing this experiment, I have tried it in my private practice in curable cases where I
Mhm.
have given tuberculinum weekly dose and patients have responded well. So that is the progress. That is the new thought. See,
Yeah.
when Hahnemann was writing his organon, with every organon, he was changing. Now, this is what he has found, and this is what he has found. So every organon had something different. So this also is, so we cannot um, uh, go by what has been given. Those have been great discoveries, but they have to progress. And this is what I experimented and I have found. And I have not seen, I've seen more than 400 cases of tuberculosis. And in at least in more than 100 cases, I have given tuberculinum weekly dose with advantage. But again,
Certainly.
I will say I have not only given tuberculinum, I will not give tuberculinum without a constitutional medicine. And also, when the patient is very sick, acutely ill, like a lot of fever, a lot of, yes, acutely sick, then I don't give tuberculinum at that stage. When he becomes better, the acute symptoms become better, then after constitutional medicine, uh, I will give tuberculinum. So it has to be given judiciously. You just cannot rely, because it's so easy to say, give tuberculinum, give Cilicia, and not try to find the constitutional medicine. Constitutional medicine doesn't have to be preceded by tuberculinum. It has to be followed by tuberculinum.
Anyway, thank you very much that I'm partially convinced about that, your statements, and you have cured 400 people. It means there's something that
Yes.
I need to insist myself that certainly change is there, because from already before COVID, we have started to listen over great teachers like you that we must change our mentality of Burnett. We have to change our mentality of Kent. We have to change the mentality of our guru, Hahnemann, I'm talking about that. But
Yeah.
Kent theory still,
No, see,
I personally, sorry for that, to finish.
sorry.
Personally, I keep it, but we need to change. That I agree. But this sensitivity about this Nasod gave me to make these questions. I regret for that.
Very good. You must react. See, only when you react, then you understand. See, when we were doing those 142 cases, there was a big debate in college with all
Yeah.
the senior doctors, and they were all against tuberculinum. There was only one doctor, who was Dr. Bansidhar, who said, yes, we can give tuberculinum in acute cases. Now, tuberculinum in acute cases it's not written anywhere in the book, any book, that you can give
Yeah.
tuberculinum in acute cases. And we have found that tuberculinum in acute cases can be given, and with benefits.
Yeah.
So that is the new thing that we have found.
Yes. Thank you for this very new that I need personally to add for my.
Yes, you can experiment. Why not?
Yeah.
Try and experiment it on extrapulmonary case before you
Yes.
try it in pulmonary case. Yes.
Thank you, doctor, very much. Really, I appreciate
Welcome.
especially for 400 people to have this benefit about the
Yes.
health. It should be very grateful to you. Thank you.
Thank you so much, sir. Thank you so much, ma'am. Thank you, Dr. Poonam, ma'am, Dr. Kusum, ma'am. I hope there are no more questions. I hope all the doubts are, all the queries and doubts are clarified now. Heartful thanks to all our viewers and followers who have joined us today. We have such webinars lined up in the upcoming sessions with many more renowned homeopaths. For upcoming webinars, you can follow us on our social media handles, or you can visit the website kavitakehomeo.com. I'm also thankful to KHA volunteers for the continuous support and selfless services with which we were able to organize these webinars in a successful manner. For any other info, you can reach us at kstudygroup@gmail.com. Thank you so much.
KHA Homeopathy Study Group Pro Bono, Ethics and Benefits. To be a KHA speaker, one needs to be at least 1 to 2 months of active volunteering. Only KHA speaker teams are promoted in newsletters and webinars. KHA provides volunteering for 2 to 12 months, respects and inspires volunteers to grow. Active volunteers will be promoted through our website, social media, and added to WhatsApp group. Articles of volunteers will be posted on KHA website and newsletter and will be sent for publication at other channels too. Volunteers and speakers are eligible for prestigious KHA annual awards. Volunteers are eligible for KHA inspirational talks. Volunteers are eligible for case discussions. KHA promotes homeopathic organizations as well as their mega events. KHA promotes great work of speakers through their book reviews. Honorable guests may propose their future courses or events after the webinar. KHA maintains a healthy and happy environment, which keeps only like-minded folks. KHA requests everyone to maintain the confidentiality of the group. Thank you.
Thank you so much, sir. I hope we had a great learning session from both of our speakers. Thank you so much for being with us.